Hello, everyone. Today I will be talking about erectile dysfunction and its prevalence in our society. So, for a little bit of background information, for those of you who don't know, erectile dysfunction is the inability for a man to get and maintain an erect penis that is required for adequate sexual activity. This is commonly referred to as ED or impotence. And typically, ED is an issue that mainly concerns older people, but recent studies have shown the prevalence of experiencing consistent erectile dysfunction is increasing among many age groups. 20% of men below the age of 40 and nearly 70% of men above the age of 70 have been affected by erectile dysfunction. And as stated in class earlier this semester, 1 in 4 people will be 65 by the year 2030. So the exponential growth in ED cases will follow, and there will be an assumed jump from 100 million to 355 million worldwide. Okay, and to go into the causes a little bit, studies show that there is a difference between the causes for older men and younger men. And historically, erectile dysfunction was known to be due to psychological issues or just aging itself that would inhibit sexual performance. But now there's a change in medical opinion that erectile dysfunction in older men is not purely due to the aging process, but instead is commonly caused by conditions that block or inhibit blood flow to the penis. This includes atherosclerosis, which is the hardening of blood vessels, and also diabetes. Erections are controlled and produced by your nervous system. So medication that suppress your nervous system, such as diuretics, antihistamines, antidepressants, treatments for hypertension and cancer, would also therefore affect your ability to get an erection. For younger men, they follow the previous medical opinion that most commonly erectile dysfunction is due to psychological issues, such as depression, anxiety, childhood abuse and trauma, or sexual fears and tensions with your partner. And now that we understand what it is and some of the causes of it, let's discuss why this matters. The study listed above, Prevalence and Risk Factors for ED in the US by Selvin et al. Discusses the real dangers that relate erectile dysfunction, other than just general annoyance due to sexual frustration and hormones, to more dangerous implications. And it emphasizes that erectile dysfunction is a link to cardiovascular disease, and it is a comparable risk to obesity, high blood pressure, diabetes, and smoking. And this study mentions, as previously mentioned, that erectile dysfunction is an issue regarding blood flow, and more importantly, the restricted blood flow. So the study explains that the penile vessels are a lot smaller than coronary arteries and vessels. So any developments of cardiovascular disease or just heart issues can often be manifested and appear first in erectile function. And for some statistics, those with erectile dysfunction had a 62% chance of a heart attack later in life. And 90% of men with ED have at least one of the major CVD risk factors, including hypertension, diabetes, smoking. This study also goes into and examined erectile dysfunction in its relation to levels of physical activity. And it found that only 28% of men with ED had reported vigorous physical activity in the last 30 days. Results also found that high levels of sedentary behavior, for example, 5 or more hours of computer use a day or just watching TV, had increased risk of ED with an odds ratio of 2.94, which is a lot. So for some treatments, as the study suggested, that since there's a correlation of lack of physical activity and erectile dysfunction, changing lifestyle habits and increasing physical activity levels can be an effective non-pharmacological treatment plan and also prevention option. And prevention is important because if you have not had an erection in 5 years, it is unlikely that you can reverse those effects with treatment or anything. It is also, and then the other treatment options are a penile loop, which will prevent draining of the blood from the penis, oral medications and herbal supplements, for example, Viagra, which we all probably know, and then one of the herbal supplements is horny goat weed, and then pycnogenol is just something else with the article listed. And it's also important to note that herbal supplements have less medical literature supporting their use. Penile injections and intraurethral suppositories are reserved for those who failed to change their lifestyle or cannot see results from just changing their lifestyle. It is also important to keep in mind the psychological factors that were mentioned earlier in regards to a common cause for younger men with ED, because ignoring them can cause medicine to be ineffective. And the study emphasized that since erectile dysfunction is related to dangerous diseases such as cardiovascular disease, getting a pill for sexual performance can just be a band-aid to a much larger issue. There should be encouragement to look at the whole picture down to your entire physiological function rather than just the fact that you're not getting an erection. And why should you care? So in relation to class, I hope that this has some relevance to you all because we learned that cardiovascular disease is a leading killer for older adults. Our whole class has been revolved around how we can ensure that we can age well, and the bidirectional relationship between ED and CVD is something to note. I also want to mention some social implications. I feel like sexual health is perceived in a skewed way in our society, and there are a lot of men that joke about ED because they judge or base themselves based on their sexual performance or the ability of them to perform. And I think that is stupid, and that any embarrassment regarding ED is not worth any of the possible health implications that may come from it. Consistent erectile dysfunction is not a normal part of aging, and that part of your life does not have to be taken away. So if you can't get it up, go to the doctor. Thank you. These are our references. Nice.